Hey guys, it's Dr. Devin Vrana. I am eager and excited to have you back, as always, to If They Knew, where today I'm hosting a good friend of mine, a beautiful and powerful chiropractor from Lawrence, Kansas, Dr. Amelia Rodrock. But her and I are talking chiropractic today. I've invited her here because this episode has been inspired by a handful of women in my practice. I create this podcast for my practice, for my community, for my friends and family, about topics that we want to know more about. So when waves of women started popping up in my life and practice saying, hey, what do you know about breast implant illness? And a year ago, I didn't even know the topic existed. And really, over the last few months, I'm barely scratching the surface to understand it. I knew that this was a relatively common procedure in our culture. Close to 300,000 breast augmentation surgeries are done each year. But I didn't know how many women were going back to the surgeons with things like joint pain, headaches, GI issues, depression, anxiety, chronic fatigue. I had no idea that more and more women were going back and electing to have them taken out. Now, I had heard and seen bits and pieces of Dr. Amelia's journey. So I asked her if she would be brave enough to share more with all of you. And of course she said yes. She's opening her heart today. She's sharing resources. You guys, I had no idea that over 100,000 members are in a Facebook group called Breast Implant Illness and Healing. This is a growing topic that we need to shine some light and understanding into. So I'm thankful to her and I'm thankful to you. And if anybody you know can benefit, please share it forward with them. Officially welcome to the show, my friend, Dr. Amelia Rodrock. Hi, everybody. It's Dr. Devin, and I'm so excited. I have a almost local. I wish we were close enough to do this one in person, but we're sending our free hugs virtually to one another today. I have Dr. Amelia Rodrock here with me. We both went to Cleveland Chiropractic College. We've both hustled the single mama game. We have both started practices. We both have chiropractic husbands. I feel like we have a lot of things in common, and I've been dying to get her on this show. So everybody say hello to Dr. Amelia.
Hello, everybody. It's so good to be here.
Now, tell people out there, if they don't know you, where are you at? Just give them that little elevator. Who is Dr. Amelia?
Yes. So my name is Amelia Rodrock, and I practice in Lawrence, Kansas. My husband is a chiropractor as well, and he practices in a small town outside of Lawrence called Baldwin City, Kansas. I have been in practice since 2013, so a little over 7 years now. I opened my own practice. My husband Jeremy's been a chiropractor now for about 20 years. And so when I graduated, he had already been a chiropractor for 12 or 13 years. So I just really wanted my own space. So I opened my own practice in Lawrence. And, we're a family practice. So lots of moms, lots of children, but just lots of everybody. And we have a lot of fun, and we're having a good time in Lawrence.
And you live on a farm.
I do. Yes, I live on a farm. I have goats and sheep and pigs and turkeys and chickens and ducks. And I think that's it. So
I love you guys' social and the shares of getting to see the goats and the just that real living. I mean, that's the country girl heart in me. I love it. Now, premise of this show, because you and I could run with this in so many different angles, but premise of the show is like we always hear at the seminars that you and I go to. If they knew what we knew, they would do what we do, right? And that could fit lots of different things. But I know over the last few years, you've had a very special journey that I wish more people knew about. And there is one thing. So if that one thing you wish more people knew and talked about, what would that one thing be for you?
So the one thing for me is I really want women to know more about breast implant illness. So many women get breast implants. I think in the United States, it's like 300,000 a year or something astronomical. It's ridiculous how many women get breast implants. And there's a variety of reasons. I mean, sometimes, they find a tumor, they have breast cancer, they get a double mastectomy. And I mean, I understand it would be very difficult not to have breasts as a woman. And so the go-to is implants, or, they breastfed. I mean, I know with me, I got mine because I breastfed kids and I didn't like the way they looked anymore. But when you go get implants, just like a lot of things, they don't give proper informed consent. They don't tell you the possible side effects. They don't tell you what they're made out of. They've not studied them. So it's a problem, and women are getting sick from them at high rates.
I have to pause there because I mean, like, I know, like I shared with you right before we hit record on this, like I've had 5 women just in the last handful of weeks. And that's how I know universe always calls us to talk about things, right? Like it starts to come up, but people come to our offices. We're both chiropractors. They come to us in pain, and that is one of these symptoms. And we do, I mean, I have 5 kids. I've breastfed all of them at over a year, and your body is no longer your body. These little people that you love, they take over, and you don't look the same. You don't feel the same. And so I've gone for a consultation. I think that, body image is such an issue. So we could go down that rabbit hole too, but for you, like, can you walk women through that might be having strange symptoms, or how did it unfold for you? And what's this journey been like? Take us into that space.
Okay. So it really started to unfold for me before I was ready to acknowledge the fact that my breast implants could be causing some problems. It was my husband who he just one day was like, you know what? I think you're not feeling good because of your breast implants. I was like, what the hell? What are you even talking about? That makes no sense to me. And he's like, no, he's like, I saw Erin Elizabeth talk about her breast implants and how they made her really sick. And I feel like you should look into that. I was like, nope, bye. And so then we didn't talk about it again for probably a good year and a half. And then a colleague of ours was going through the process of getting hers taken out. And she was telling me some of the things that she was having going on. And I was like, oh, interesting. So then I started researching it. And a lot of the symptoms for me, and mine weren't terrible symptoms. I could still work. I could still function. But some women are debilitated. They're in bed. Like they can't function at all. But for me, I thought, well, I'm getting older. At that point, I was like in my upper 30s and I'm tired all the time. I have kids and I own a practice, so I'm always tired. My joints hurt, my body aches. I used to have really weird GI symptoms, especially if we went out to eat. So I was like, I'm just getting older. Things aren't functioning like they should. And then after reading all of the symptoms of breast implant illness, I knew that they maybe weren't 100% what was going on, but they were a big factor in my body not healing and functioning the way they were supposed to. So if you just Google breast implant illness, I mean, there's a lot of different symptoms. For me, again, GI issues was the big one, muscle and joint pain, extreme fatigue, Raynaud's. So I used to get Raynaud's in my fingers, which I haven't got at all since getting my breast implants out. Oh gosh, what else was some for me? Neurological issues are some. I didn't really have much neurological except maybe Raynaud's. Memory issues. So there's just a ton of different symptoms that could just be like I'm getting older, or I just don't feel very good anymore. But since going through the process of getting mine out, I feel so much better. Like I said, I don't get Raynaud's anymore. I don't have my GI issues anymore. I used to get terrible bloating and cramping every time I ate, especially if we ate out. That doesn't happen ever anymore. I heal better. My muscles feel better. My joints feel better. Everything just functions better, because what we don't realize and what we're not really told is, we're getting a foreign object in our body.
Right.
And our body doesn't want that in there. And when you get somebody else's kidney, you have to take like anti-rejection drugs because your body doesn't want it. And the same thing with a breast implant, or any implant for that matter. So the body tries to reject it, and the body can't really reject that. Can't kill it, can't die off because it's not living. So it walls it off and it protects itself, and it forms a scar tissue around it. But then it starts to break down that implant, and all the stuff in the implants start to leach out into the body.
Now, which type of implants did you have?
I had silicone implants, which I have right here with me. I kept mine, but I had silicone implants. And some people are like, oh, well, I have saline, so they're fine. Saline totally, it's just salt water. Yes, but what is that saline in? It's in a silicone shell. So it doesn't matter if you have silicone or saline. It all has the same neurotoxins and harsh chemicals and all of these terrible carcinogenic ingredients are in these breast implants, whether you have silicone or saline.
And I have a good friend and patient that she's going to get hers out in about a week, because she's certain, she's a nurse, she's been getting adjusted for 7 years. She's like, I know my body. And it was connecting her to you and some of the resources that you shared that she went, oh my gosh, like, and now she went back to plastic surgeon and they said, no way.
Yeah.
Like, did you hit some of that with the surgeons, or what, what do you suggest to somebody that, because it isn't everybody, right? Like, not everybody reacts the same way. That's the thing about our body's intelligence, is we're all adaptive in different ways. We have different environments, different, stresses, all the things. Yeah. What suggestions do you have as far as differentiating, like, where do you go if you're wondering, maybe this is me?
Yep. And so I'll hit on the it's not everybody thing real quick. I don't think everybody reacts the same, but I think at some point in time, every woman will have a problem with their implants. They're just not something that should be in our bodies. Like, we were not designed to have artificial things in our bodies like that. So even if now, like, you've had them for 10 years and you feel fine, maybe in 15 years you won't, or maybe you just got them 6 months ago and now you can't get out of bed. Everybody is different. And at some point, I feel like everybody's going to react in a certain way. So when I first decided to get my implants out, I started doing a lot of research on social media, because there are a lot of groups that are dedicated to breast implant illness. So I got on those groups and I started researching the doctors and started trying to figure out, where I wanted to go. And then my colleague went to a specific doctor in Florida who now only does explant. He doesn't even put breast implants in. So I decided I was able to travel to Florida and get mine out by him, by a specialist who only does explant surgery. But there are a lot of women who I've heard who get a lot of pushback from plastic surgeons. I mean, breast implants are the bread and butter. I mean, it's a quick surgery. It takes like an hour and a half to put them in. They get paid $5,000 to $10,000. I mean, it's good money. So of course they don't want to acknowledge that it's possible that they could be causing problems. I feel like it's like that with a lot of things with some medical professionals. So they don't want to acknowledge that it's causing the problems, and then they don't want to go do the research or go look up and try to figure it out for themselves. But I feel like if they would just think logically, they know, again, foreign objects aren't great for our bodies, and then something could happen. Everything has a side effect. It doesn't matter if it's a good side effect or a bad side effect. Everything you put in your body causes something else to happen, good or bad. So there are a lot of surgeons, plastic surgeons, who will give you pushback. Or they'll say, well, let's just change them out. They're fine. Let's just change them out. They'll be okay. Or let's put a different kind in. And I'm here to tell you, listen to your gut. If you think your implants are causing you problems, go find a different doctor. Go to somebody who will actually listen to you, and then go to somebody who does it right, because there is a right way and a wrong way to do explant surgery. I talked about that scar tissue capsule that forms around the breast implant. That has to come out too. And sometimes that's attached to like ribs or other tissue. So they really have to make sure they get all of that out, because that could harbor all the chemicals that have leached out of your breast implants in that scar tissue capsule. So that's something that some surgeons don't want to do, because it's a more intense surgery. I mean, my surgery was about 3.5 or so hours, and it went well, but I mean, they open it up from here to here. If everything's up, they have to scrape everything and cauterize everything.
Pain. What's the pain? I mean, like, I'm sure it's no like walk in the park to get it done and then to have him, taken out. Mm-hmm. What do you say to those women that are
scared of the pain? It's not pleasant. It's just something you're going to have to get through. I actually I didn't have a ton of pain. I feel like I have a pretty high, I don't know if I have a high pain tolerance or my body responds differently to pain. That's right. But I didn't have a ton of pain, but I also got a nerve block. So I didn't want to take a lot of narcotics. I've had to take them every, twice when I've had a surgery, and then when my eardrum burst a few years ago. And I don't like the feel of being on any sort of hydrocodone or narcotics. So I didn't want to take those. And they also cause a lot of constipation. So if you're taking a bunch of those, then you don't poop for days, and
Right.
that sucks.
Solve one problem, create a different one.
Yep. So my surgeon did a nerve block. So he just put like the anesthesia into the nerves around the area. So I took Tylenol like a couple times a day for a handful of days. So for me, it was easy peasy. I overdid it like my 4th day post surgery because I felt so good. So I was up walking around and, doing all the things. And that night I didn't feel good because I just did too much. So for me, the pain was very tolerable. But I think, if you are somebody who has a lot of pain, or you've had surgery before and you respond that way, then make sure you have the medication you need to take care of it, because you don't want to be in pain.
Now, I'm sure you get used to a body image, right? Depending on, size and just all of it, right? Like, I mean, our bodies as women, we go through a lot of changes anyway. Talk to us about the emotional side of that change.
I think for most women, the emotional side is probably the hardest. I think the pain is something that's very momentary. I mean, it's a few days and then it's over. But the emotional part is the hardest. And for me, the whole month before my surgery, I was super emotional about it. I was scared, one, because I don't really like going under anesthesia. But I also just, what am I going to look like? How are things going to be? What's going to be the result of getting this surgery done? And, one of the best pieces of advice I got about this was from, again, my husband. And he's like, do you remember how excited you were when you got them in? You're really excited to go. You were nervous about going to surgery, but you're excited about the change that you're going to have in your body. He's like, be excited like that. Be excited that you're going to get your health back, and that I love you, and that I don't care. It doesn't matter what your breasts look like to me. I know it does, to me personally, but not to him. And so I had to kind of shift my thinking and reframe my thinking a little bit, because ultimately your health is more important than your breasts. And honestly, I got a lift when I got mine taken out. So I like my boobs better now than I did with them in. So
there you go. And that sure ties to your specialist, right? Of like going into it, knowing like, what you want the end effect to be. And I know, I mean, we have a mutual friend colleague that went through this, and she's been very open in her social, in the share that she's gone through, and I'll take it forward. And then, guys, we'll have in the show notes, I'm going to get some of the groups and recommendations that she had, because this is like what these conversations are for me are, they're not for everybody, but they're for somebody. And then we're going to throw the breadcrumbs, and it's going to take you forward, or you might know a friend or a sister. So the last couple questions I have for you are, number one, to the women that are like, I don't like my body, I want to get, they're getting them because they, their body has changed, or they're, flat and judgmental or whatever, they're thinking about getting them, but hesitant. What would you say if you could go back and catch yourself before you maybe decided to?
I would say, one, do your research, like really do your research. I didn't. And I mean, I was in chiropractic school when I got them. My husband, he wasn't my husband then, but he was a chiropractor. We knew better. I mean, we knew better, and we still didn't do our research because it's what I wanted. So really do your research, know the long-term ramifications and what could happen. So if you decide to get them, then you know what to do about it when it starts to happen. I'm not here to say not to get them. That's everybody's choice. And I feel like it should be your choice, but just know what you're getting into, and know that if you are with a partner who truly loves you, it doesn't matter what your boobs look like. I mean, you have to start working on your inside and start working on, what's going on with you and why you think you need them. Do some transformational work, get a life coach, do something to make sure you're right in here before you start changing out here. Because honestly, if you're still wrong in here when you get these, you're still going to be wrong in here, just with bigger boobs. Nothing changes. It doesn't change. You might feel good for a while because you're like, look at these. They're nice and perky now. But it's not going to change in here. You're still going to not love yourself. You're still going to think you're not perfect. You're still going to pick on yourself and poke your belly and pinch your cellulite. It's not going to change. It's just going to change the way your boobs look. And it's just really not worth it. And you can also do a fat transfer. Like, that's something that's an option. So they can suck fat right out of your butt and put it in your boobs. So, I mean, there are other options that are a little better than breast implants if you need some, if you need, absolutely feel like you have to have something done.
And I love that you said, look, it's like the choices are there, but maybe this is time in history where we call more attention to proper risk and benefit analysis, and we go through options as all healthcare professionals, right? Like where informed consent is a very important topic, and having the full spectrum, and patients grabbing their responsibility of like, look, if I'm going to go through this, like I want to fully understand what the benefits and possible repercussions are. So we're going to attach, some of the links for research. And I know you have a Facebook group where you're doing like a love your body challenge. So that's my next question is, I always end with like, how do we talk to our moms? Because like women, and I'm a woman, so I'm totally biased. We all have the weight of the world on our shoulders, but I specifically want to reach out to the mama bears and tie this into all this stress, but also around body image. I mean, I can't really remember a season in my life where I liked my body, right? And I have so many friends, be it like, surgical, transformations, or mental health issues, or eating disorders. I mean, and I have a daughter, I have 4 sons. It's like the body image isn't just a female issue. But if you could speak to the moms of like, if we look to the next generation, how do we do better for them? How do we love our babies and teach them self-love? What do you say to the moms? What do you say to the next generation?
I guess what I would really say is, they're watching. They're watching you. Everything you do, everything you say, every time you look in the mirror and you're like, ugh, and disgusted with your body, your daughters are watching you. And I wish I would have really realized this when my daughter was young, because I know she was watching me. And they're going to do what you do. So if you want them to do better, you have to do better. You have to, maybe you can't love your body the way it is, but learn to at least be comfortable enough with it that you're not picking it apart all the time, because it's not going to change. I mean, you can lose weight, you can gain weight, you can have surgery, you can whatever, you can suck fat out. I mean, you can do all the things, but again, healing is an inside job, and all the things you do on the outside aren't going to change the inside. So you need to start working on the inside. You need to start figuring out your past stories and figuring out why you have these limiting beliefs about yourself, which is a lot of the work I've been doing for the last handful of years, is, figuring out my own stuff and how that has held me back. And a lot of it's about body image. I mean, I can remember boys in, middle school or high school and some of the terrible things they said. And you know what? They were 13-year-old boys. Like, they didn't know what they were doing. But I remember, as a 40, almost 1-year-old woman, I remember what they said. So one, teach your boys, what to say and what not to say. Teach them how to love and how to just love people and be around people and not say things that could potentially damage somebody when they're 40. And then teach your daughters that, their bodies are going to change, but that's okay. We're beautiful at every stage of our lives, and they need to show up. You need to show up powerfully for your children. That's what I would say. Show up powerfully.
I love it. And you've made me like tear up. I mean, even when you were talking about Jeremy and just how he's shown up for you through this, and that, they're watching. I mean, that's it. That's that applies to so many conversations here in 2020. And I see this tree behind you, and I think we're in this dramatic healing phase as a collective. And if we got to know our bodies, if we trusted our bodies, if we felt empowered in our own skin, and really loved on those limiting beliefs and old storylines a little bit more, we'd probably be in a better state of the world. I mean, like, this is a expansive little big idea, right? How do people connect with you if they want more information, or if they have a question for you, or want to join your Facebook group? What's that look like?
So there's a couple ways. I have a couple of Facebook groups. So I have my breast implant illness one. So if you are a woman, I only let women in, so don't try to come in then. I won't let you in. But if you are a woman who has breast implant illness, or if you're doing research on breast implants, or somebody who maybe has breast implant illness, you're more than welcome to join. That group is called Breast Implant Illness, Detoxing Mind and Body with Dr. Amelia. So that's a good way to get a hold of me. Maybe you're just a woman who is starting to work on some mind stuff or some transformational stuff. I have another Facebook group that I dedicate to that. And that is called Transforming Self with Dr. Amelia, helping women thrive. I also have a podcast called Transforming Self that I talk a lot about this kind of stuff in. So you're more than welcome to subscribe and listen to that. So those are the best ways. I have an Instagram. You can get on my personal Facebook page, whichever, but
you can go get adjusted. If you
can come get adjusted.
She's got magic hands and heart of gold, which I'm sure you guys can feel through the screen. And I hope that, events are a thing sooner rather than later. So we can go to a Tony Robbins or go to one of those transforming events and get to hug each other in person. And I am fairly certain that I will have you back. And I know you come to Wichita. So next time, we'll get together in person. We might even invite the husbands. I don't know. Maybe we'll have a big discussion around that. But anything closing to the people that you want to share?
No, just, women, like I said, listen to your gut. Listen to your gut. You know what's right and wrong. Listen to yourself. You have that intuition, and reach out if you need anything. I know Dr. Devin's here. I'm here. Just reach out for support and for love. We are here for you.
Always, always. So if they knew what we knew, they might do what we do, and we hope other people do, which is open our minds to bigger health and happiness. We love you. We appreciate you. I'll be seeing you soon. Check the show notes for her breadcrumbs, and I'll see you soon. Well, so did you learn something new? Because heaven knows I did, and I always do. That's why I'm so grateful that these amazing women and men sit down with me to have these conversations and interviews, because I'm often left speechless on the backside. I had no idea of what women like her had gone through. This is an opportunity for me to learn more so that I can be better and do better for the women that come into my practice and ask me before they have a procedure like this done, what do you know? Good, bad, indifferent. What resources? Because she said, go do your research and trust your gut. So this will help me empower more people on the front side, but it also helps me show up for the people that are coming in for, pain and headaches and fatigue and have all these symptoms that they can't quite nail down. Well, maybe that helps me lead them and support them in their own healing journey to understand if this is something that they're dealing with. That's all we're trying to do, right? Learn better, be better, do better. The one, that really hit me hard was when I asked her about future generations and what she says to the moms. And she says, they're watching. They're watching. And you can apply that across the gamut. They're watching as we make choices. They're watching as we choose the health and wellness lifestyle we want to lead or not lead. They're watching as we navigate the stress and turbulence of everything that we're going through right now. They're watching. And they will do as we do, inevitably. And I get that none of us are perfect. But the acknowledgement that how I feel about my body image, how I choose with my own health, is going to wildly influence my daughter and my sons. That responsibility, that acknowledgement is huge. And man, I'm going to sit in a prayer with that one. So thank you, Dr. Amelia, for the way that you put that and the way that you shared in all of it. I know that someone watching this right now needed to hear it. I know that maybe it isn't for you, but somebody either thinking about the procedure or that you're like, I wonder if this is what's going on. Light bulb moments, right? We talk concepts, we talk ideas, and then we see where we go from here. Because it's a journey. And I'm here for you. And I'm grateful for the women in my practice that inspired me to do this in the first place. I'm listening. I'm always listening with my friends and community and my practice members. What do you want to learn more about? What do I need to understand more to navigate the road ahead and support you the best that I can? So I love you guys. I hope you are as empowered in this conversation as I know I am. Thank you again to Dr. Amelia, and I'll see you guys next time.